welcome everyone to the 14th Annual Elder Justice Training. Hard to believe it's our 14th year, but we couldn't be more excited to be able to offer you a pretty thought-provoking agenda for today. As you can see on the slides, we have an agenda that's available to you just to show you what we'll be doing. Our first presentation will be at 8:45, so we will be doing that introduction shortly. But I want to call your attention to a couple of things. First of all, we will take a break at 10:25. Lunch on your own will be from 11:50 to 12:50. We'll also have a break at 2:20, and then we will adjourn at 4:30. I should also tell you that my name is Julie Masters. I am a faculty member in the Department of Gerontology, and I will be your moderator for the first half, and then the real A++ moderator will join you in the second half, and that'll be Mary Wilson, who is an attorney here in Nebraska. We want to make sure that we just take a moment and acknowledge our sponsors for this particular event. A special thank you to the Nebraska Department of Health and Human Services, the State Unit on Aging, AARP Nebraska for their support and encouragement, the Better Business Bureau, Legal Aid of Nebraska. And you should know that Legal Aid of Nebraska provides civil legal assistance to those 60 and over, including those who are victims of elder abuse and financial exploitation. The UNO Department of Gerontology, the UNO Grace Abbott School of Social Work, and Iowa Western Community College are the sponsors for this particular training. Also want to give a shout out to Nebraska Public Media for once again hosting this particular training and all their support. Finally, we want to thank Anita Weiskup, who is responsible for the overall coordination of this particular training. We're grateful to her, along with the planning committee members. Excuse me. We do want to call your attention to the Elder Access Line, and while that was mentioned, we just want to briefly bring that up again. The Elder Access Line is available to people 60 years of age and older, and it covers all 93 Nebraska counties. The questions are answered by qualified and experienced attorneys or paralegals, and advice is provided regardless of income. The Elder Access Line is available through 1-800-527-7249, and services are offered Monday through Thursday, 9 a.m., pardon me for just a moment, 9 a.m. to 12 p.m., 1 p.m., and then 1 p.m. to 3 p.m., and then on Fridays from 9 to 12. Now, to get to the housekeeping, and I have a slide that triggered mouse. You'll have to forgive me that has a mind of its own, so my apologies. So a couple of housekeeping items that we want to make sure that folks are aware of. First of all, just as a reminder for those of us that are here in the presentation room, we do have the gift of American Sign Language interpreters along with closed captioning that's available to people attending this training. Again, for those of us that are in the room, we just have to remember that any sound, any commentary will be picked up by them, so we want to refrain from having any additional talking. As far as housekeeping, questions can be called in or emailed and will be provided to the speakers. The phone numbers that are available for questions, and we have Eric White, who is manning the laptop here in the room. Questions can be sent to either calling 402-314-7339 or 402-471-2307. I want to note that those numbers are not toll-free numbers. You can also email your questions to dhhs.aging@nebraska.gov. And any of those questions will be provided to the speakers. Also, we would encourage you to go to the website for this particular training. At the website, you'll find several things. One is the streaming link. And if you're streaming, and welcome to all of you that are streaming, if you're streaming, you've already found the link. But if you're listening and would like to find that, it's available. CEU and CLE application information is also found on that particular website, along with the appropriate links. You'll find the presentation PowerPoints for each of our wonderful speakers. And then you'll also find a SurveyMonkey link or the QR code. And you'll notice that on our slide, there is a QR code that you can scan. We'd ask you to scan after the presentation, or going to the SurveyMonkey web address that is found on your screen. Excuse me, let's move this a little. That's found on your screen as well as on the training website. Regarding CEUs, it's important to share some important information with you. First of all, CEUs are available for nurses. 6.65 CEUs are provided to Nebraska residents only. To receive Nebraska CEUs, please follow the CEU form posted on the website. This process is only for licensed nurses. Other professions do not need to complete these steps to receive credit. After the training, you are required to complete the evaluation. The link and QR code, again, are on the slides. This link can be used for nurses' CEUs. The evaluation, it's an important date. The evaluation is required to be completed by November 13th, 1 week after the training. Information regarding mental health social work CEUs is also available. This program is eligible for 5.5 contact hours. Collecting the mental health social work CEU certificate is a one-step process. Participants need only complete this following survey, and that survey is at https://unomaha.formstack.com/forms/survey elder justice, or by using the QR code that will be provided at the end of the training on November 6th. Please note that the survey that you will be completing is specific and required for mental health and social work CEUs. There are directions on the State of Nebraska website if you need further information. And again, that website is dhhs.ne.gov/pages/Aging Elder Justice Training.aspx. In addition to the training CEUs that are available for people within mental health, social work, and nursing, there are also CLEs for attorneys. And this training has been approved for 6.1 CLEs for Nebraska attorneys. Your bar number is required for credit. If you did not include it with your registration, please do send it to dhhs.aging@nebraska.gov. Please complete the evaluation after the training. After the training, you will want to apply directly with the MCLE Commission to receive credit. The distance activity number is 262982. The distance activity number, again, is 262982. And the regular traditional learning activity number is 262981. Again, the traditional or regular learning activity number is 262981. If you are attending at one of our remote host sites, please make sure that you sign in. This is required if you are applying for CEU or CLE credit. And again, all this information was included with the confirmation email sent for those who registered online. We also want to ask that if you are a host site or in person and requesting a certificate of attendance, please fill out the evaluation at the end of the training, and in the comment box, your request plus your email address. Again, if you are attending at a host site, one of our host sites, perhaps the state of Nebraska, or you're in person and requesting a certificate of attendance, please fill out the evaluation at the end of the training, and in the comment box, your request plus your email address. And these instructions will be repeated during break and then at the end when Mary Wilson takes over as our moderator. All right then. So it is our great pleasure then to move on to the agenda and to introduce our first speaker. Jacob Kawamoto works as a program specialist for the Nebraska Department of Health and Human Services Division of Medicaid and Long-Term Care. He also serves as the division's Tribal Liaison. Jacob is a part of the Medicaid and Long-Term Care Policy Team, where he assists with writing regulations, coordinates with federal partners at the Centers for Medicare and Medicaid Services to update Nebraska's Medicaid state plan. He also helps to ensure that the agency and Medicaid program comply with all federal and state requirements. As the Tribal Liaison, Jacob also focuses on tribal health and ensuring that the Medicaid program honors and follows all federal provisions related to American Indian and Alaskan Native providers and beneficiaries. So if you would, please give a welcome to our first speaker, Jacob. Jacob, welcome. So Jacob, as we stop, you need to bring up your slides. Do you see this? Beautiful slides. We're so grateful that you'd be our first speaker.
Glad to be here.
Come. All right. Jacob, and here you are. I'm going to get you started.
All right, well, thanks Julie, and thanks everyone for having me here this morning. Excited to talk about Medicaid. I'm sure everybody here is as well. Really thrilled. Everyone's favorite topic. And I got to say thanks to Anita for asking me to, oh there she is. Thanks Anita for asking me to be here and to give this presentation on Medicaid. And also a special thank you to Mrs. Mary Wilson. I've actually known Mary my whole entire life. We grew up going to church together, and Mary helped cultivate in me a real love for music and for Jesus, both of which I carry with me today. So thank you, Mary, and it's cool for our paths to cross here today in this forum. And yeah, thanks for all the work you do. You can tell you really invest a lot here. So, like Julie said, I am Jacob Kawamoto. I work as a program specialist in Nebraska Medicaid, and really that means typically I'm like reading regulations, writing regulations, drafting policy memos, all those really exciting things. Oh yeah, totally. We're going to share the screen so that the, and maybe we escape, so that the ASL interpreter can be on as well.
Oops. That would just make them small. Should that be?
That looks like it. Maybe if we get that to be
Okay.
all of the focus.
So what we want to do is go back to Zoom. Okay, and zoom out. You do that well. That is my fault that I did that.
Sorry, Jacob.
No worries.
My apologies to Jacob
You know, someone's
and
got
to our interpreter. So we go to share. Oops. Go ahead and share. And then
screen.
that's great. That's his presentation. And then share.
There we go.
And then we'll want to come up. It's a slideshow and make it from the current slide.
Ready to go back,
Awesome.
Jacob? Okay.
Thank you.
Awesome. No worries. Thank you guys for getting that
And my apologies.
all figured out, and thanks to the ASL interpreter and all the work that you're doing there too. Glad to be the guinea pig and make sure everything's going well. Someone's got to do it, right? So yeah, today we're going to talk more about Medicaid, obviously, and you know, the caveat about me writing regulations, all that to say, typically I'm not necessarily giving presentations on Medicaid. There are a few things in here that aren't the most up-to-date figure-wise, so I tried to come with some more up-to-date figures. I pulled this from a previous slideshow that our communications team had made, and added some slides too around kind of an overview of long-term care generally, just given the audience and the nature of this forum too. So we'll talk about Medicaid, the history, the overview, Medicare versus Medicaid, Then we'll talk about Medicaid eligibility, how someone becomes eligible, what programs are offered under Medicaid, and then Medicaid services, what services are offered to folks who are enrolled in Medicaid. And like I said, kind of sprinkled throughout that is just a long-term care overview where those pieces are relevant to the process. So history of Medicaid and the overview. What is Medicaid? At its core, Medicaid is a jointly administered program, so both the federal government and the state government partner together to administer the Medicaid program. And that's true in any given state. And it's really targeted to provide assistance, medical assistance to low-income individuals, or maybe other folks in different categories, maybe folks with disabilities, parents and caretakers, former foster kids. So there's sort of all these different Medicaid programs, but it's specifically aimed to provide medical assistance to those groups that could be covered. And again, it's jointly done by the federal government in partnership with the state. And it's actually one of the state's largest expenses. So on the screen, the figures for 2018, but those figures in 2022 were closer to $3.8 billion. But again, that's administered jointly with the state and the federal government. Not to get too into the weeds, but so here it says, funding comes from both those sources, and just over 50% of that funding comes from the federal government, but it also depends on the program and the specific thing to Medicaid. There's people way smarter than I who do all those financial calculations and all the federal matching, but essentially that came out to about, one source said, about $1.1 billion for federal fiscal or state fiscal year 2022. So yeah, it's a significant expense for the state, but also a lot of things are offered through Nebraska Medicaid. And I would say Nebraska Medicaid offers quite a lot of services, and it's a really good program, all things considered. So the history of Medicaid, it was created in 1965 as an amendment to the Social Security Act. And so Title 18, amending the SSA, created Medicare, and then Title 19 created Medicaid. The two are commonly confused. I'll admit, before working here, I didn't really know exactly the difference. I knew they both were out there. Medicare, though, largely covers older Americans, folks who are 65 or older, and there are other, disability or other criteria where someone could qualify for Medicare before that age. But that's generally what Medicare is. Versus Medicaid is again more targeted to low-income individuals or individuals with just maybe different life circumstances that Medicaid could help cover. And in each state, those programs will be a little bit different. And we'll talk about some of those programs for Nebraska. And so as of 2020, about 76 million people were on Medicaid nationally, 62 million people on Medicare. And those populations can overlap. So someone can be on Medicare and Medicaid both at the same time. There are a few other legislative changes that have happened over the years that impact the Medicaid program. In 1997, that created the Children's Health Insurance Program, sometimes referred to as CHIP, and that's coverage for low-income children. And in Nebraska, it's what we call it's integrated to Medicaid, so it's just another Medicaid program. Some states are what they call separate CHIP states, where they're completely separate programs and administered differently. But in Nebraska, CHIP is essentially just another Medicaid category. And then there's also the Patient Protection and Affordable Care Act, which increased funding for states' Medicaid and also gave the ability for the Medicaid expansion, what's referred to as that, so the ability to cover adults under Medicaid. So some other, this is rules, regulations, and entities, just some other players in the arena of Medicaid. There's the Centers for Medicare and Medicaid Services, and that's the federal agency that oversees all of Medicaid, all of Medicare, and they really, oversee all of those programs, the administration of them. And the regional office for Nebraska is located in Kansas City. And then Nebraska Department of Health and Human Services administers Medicaid in the state, specifically the Division of Medicaid and Long-Term Care. And that's federally required that one single state agency administers the Medicaid program. It can't be broken up into different parts and pieces. And so we manage, the funding, reviewing policy, determining eligibility, setting those kind of essentially just setting out the guidelines for how Medicaid is administered in Nebraska. DHHS and Medicaid specifically oversees all that. So the state plan, Julie mentioned that too in the bio. That's essentially our agreement with CMS, Nebraska Medicaid's agreement with CMS, saying, hey, here's how we're going to administer the program. Here's the services we're going to cover. Here's the fees that we're going to pay providers at. Here are, the different programs we're going to administer. Here's the requirements to be in those programs. It's essentially our contract with CMS. And so that allows us to draw those federal matching dollars to do, the things that we say in our state plan that we're going to do. And that's where every state plan can be a little different. A colleague on my team, shout out to the Medicaid Policy Team and to everyone who's joining us online. But a colleague of mine, he says, if you know one state Medicaid program, you know one state Medicaid program. So, I guess encouraging and discouraging all things. But yeah, it just outlines all that service delivery and those different details. And other federal, state laws can apply, different regulations can come into play. But who is on Nebraska Medicaid? So as of November 2023, there were just over 370,000 enrollees in Nebraska Medicaid. That was about 19% of Nebraska's population. And this is a good time to pause. And again, I asked Anita entirely too late if I could update these slides to reflect some of the more updated information. And not to get on too much of an aside, but the COVID-19 pandemic was obviously a big thing for Medicaid. Many of you probably heard about that. There was the continuous coverage period, so Congress federally passed legislation that said if someone is enrolled in Medicaid as of a certain date, I think it was in February or March of 2020, if someone was enrolled at that point, they had to remain continuously eligible for Medicaid. If somebody came onto Medicaid during that period, they had to remain continuously eligible for Medicaid until such a time as Congress, ended that and resumed normal operations. Normally, folks are renewed annually. So then Congress in late 2022, they passed another bill that started the unwinding period, and that was essentially states returning to normal operations, renewing eligibility cases, starting that renewal process. And so at the time in 2023, that was probably midway through that unwinding. The numbers there were larger than would be normal given all of that. Enrollment as of July 2024 was just around 346,000, and those numbers are about, one source was saying, about 40% higher than at the start of 2020. And again, another interesting thing, and we'll touch on this in the next slide, but the Medicaid expansion for Nebraska also took place in 2020. So there was a lot of things happening in 2020, a lot of folks added to the program, and so the numbers have been interesting, not quite the norm, but we're starting to see them level out. And again, it's about 40% higher than it was prior to 2020 on average. So, and you can see there the big red pie and the dark blue pie. Those are Medicaid kids, and the blue one is CHIP. So again, kids covered. That's just over half, and just a bit of the majority of folks who are covered in Nebraska under Medicaid. And you can see some of the other programs. Let me see if I can slide this. See some of the other figures. The green one is parent caretaker adults. The yellow one is Medicaid for the age blind and disabled. And that kind of softer blue is the Medicaid expansion, or adults that are covered under Medicaid. So that's just that enrollment broken up into a pie graph. So to touch a bit on Medicaid expansion, in November of 2018, Nebraska voters approved Initiative 427, which extended Medicaid coverage to that adult expansion group. Those are individuals who are aged 19 to 64 and fall within 138% of the federal poverty level. At the time of writing, that was about 17,000 a year for an individual. Now it's about 20,700 for an individual, but those sizes increase as the household increases. So a household of 4 would have a larger federal poverty level than a single person, et cetera, as that household grows. So it takes into account the size of the household. But anyone who meets that federal poverty level in that age group and meets all of the eligibility criteria for the program is covered now, or can be covered under Medicaid. And that took place on October 1st of 2020. And in the past, low income or other adults that are now eligible for the expansion group, they would have had to say maybe be a parent, caretaker, relative, disabled, maybe some of these other different categories. But now there's a specific category for them. And it covers all the normal services just like any other Medicaid coverage group would: doctor's visits, prescription drugs, dental and vision, over-the-counter drugs, which doesn't have to be applied to the adult expansion group, but again, Nebraska Medicaid is a really robust set of services that are offered. So all of those things are available to folks enrolled. And again, expansion began October 2020. They're enrolled in the 3 health plans. One of the 3 health plans, we'll talk about those more later. And those interested in being covered can apply at any time. There's not an open enrollment period. There's not a single period. Well, there's an open enrollment period under the plans, but there's not a single time where they can, it's like you have to apply in December or else you miss the vote. They can apply any time throughout the year. So now to touch a bit on the Medicaid application process. How do folks apply? It used to be through Access Nebraska. That's still some functionality, but DHHS has recently rolled out the iServe Nebraska online application. I'm seeing some heads nod and familiarity with that, which has been a really good, really awesome tool. It essentially allows a single individual to apply for multiple different programs that they could be eligible all at one time. So Medicaid, but also maybe SNAP or energy assistance or some of those things available under economic assistance or other divisions within DHHS. It's integrating and making one streamlined, easy application. It's got a lot more user, friendliness on the online aspect, given that it was created recently and not in like the 90s. So, we're trying to roll these things out to make it more accessible and a better beneficiary experience. And so folks can apply online, and they can also apply on the phone. They can call into the call centers, customer service centers. They can also request a paper application and still fill that out as well. And so we've added this slide to just touch on some of those kind of long-term care considerations, especially when folks are applying for maybe some of those, they have long-term care needs. Maybe there's disability, maybe there's something, extra services and supports that they need. It's good to just submit as much documentation as possible and submit that with the application. The Medicaid public website does have a resource documentation guide, so if folks who are assisting people applying, if they're unsure what do I need, there are guides on the website that can help walk through that. And for folks who are authorized representatives, so if a facility or a caretaker is applying on behalf of an individual, there's a spot on the application where they can fill that information out, and then the person applying can sign and attest that this person can be their authorized rep and get information, help with eligibility and enrollment, help them navigate those processes. That's part of the application, or it's also an extra form. So folks who are helping Medicaid beneficiaries, that's always a really good thing to make sure they're that authorized representative. And folks can note in the comment sections special things to consider. Again, if there's long-term care needs or services that they need, spousal impoverishment, which is where one spouse is going into a nursing facility, a nursing home, and the other spouse isn't, kind of how to navigate those. So those things can be noted here. Emergency medical services, which we'll talk about a little bit later. And if the applicant is deceased or incapacitated, maybe they're retroactively applying for somebody, they can note those things as well, just so field workers have all the information. That's really the main key, I would say, is just the more information, as much as you can provide, the better. And then everyone, the folks who are running those applications, can really make sure that gets processed correctly. So eligibility for the program and what programs are offered under Medicaid, we'll talk through that here. So the primary eligibility requirements, obviously someone has to submit an application to apply, but then there's, all these things listed on here are things that could be required. There are some that are always required, citizenship, they have to be a Nebraska resident, social security number, but again, some of these things might vary or affect which program they're most applicable for, like their age, if they have dependent children, if they have relative responsibilities, the makeup of their house, and some of those taxable income sort of considerations. If they have resources, that's especially prevalent for long-term care cases, what their income is, and just other categorical factors. So that's a list of everything that might be needed, but not all of that is needed in every case. But again, it's best just to fill out as much information on the application as possible. So how is eligibility determined? There are some things that are set, some things, standards for medical need, and things that are set in statute that, the program doesn't have any leeway to change. And that's especially true around the age, blind, and disabled groups. A lot of that's all federally set. But then income guidelines are based on the federal poverty level, and again, can vary for some of those different programs. We talked about the Medicaid expansion one, but then there are some, like the CHIP kids is, I think, 214% of the federal poverty level. It can be lower for other groups like parent caretakers. So some of those income levels can vary by program. And two things to know about, eligibility being determined. There are kind of two large buckets that a case could fall into. There's MAGI, which is modified adjusted gross income, and that's really a taxable income methodology. So it's looking at what is their taxable income and using that to reference then the federal poverty levels for these different programs. The other one is non-MAGI, so that's any Medicaid category that does not use that MAGI methodology. It doesn't look at taxable income necessarily. With non-MAGI, there's generally also a resource test. Other things can come into play. So those are kind of the two main buckets of categories. And then there's different programs within each. So, and this is another slide we added for that kind of long-term care consideration, resources, and what that means. Most non-MAGI programs have a resource test. So, they require folks to say, other assets that they have. Again, given the long-term care needs that they have and the expenses, it kind of takes in different things into consideration. Generally, a participant can only have $4,000 in countable resources to qualify for a non-Magi program. If they're a couple, that amount increases to $6,000. And certain resources are not included in the countable amount for their resources, like a vehicle, barring certain exceptions, like if they have like a sports boat or something outside of the norm. But vehicles, homes, certain prepaid burial arrangements, and resources that are used in their self-employment. So some things can be disregarded or aren't counted towards their resources for those eligibility purposes. So who is considered aged or disabled? Aged participants would be anyone who's eligible who is over 65. And then disabled, that's really set by the Social Security Administration. That sets the criteria for disability, and Nebraska Medicaid follows that. For Medicaid purposes, a disabled participant would have to meet that SSA disability criteria or be approved by the state review team, which follows the same criteria as SSA. So a disabled person transitions into the age category at the age of 65, and certain categories of services that require participants, certain categories do require folks under 65 to have that disability determination in order to qualify for those programs. Some of those, and I know Karen Hausman is on deck with an awesome presentation more about the waivers, and Medicaid waivers really go hand in hand, but some folks are able to receive long-term care services in their homes. These are called Home and Community-Based Services, or HCBS, sometimes called waiver services. And to receive these, someone has to need a nursing home level of care where they're at, but then they can receive those services and supports in their residence as opposed to having to go to a nursing home. So, they can receive that in their personal residence. It could be a shared residence. It could be an assisted living facility. Wherever they're living, they could receive those services and supports above and beyond what Medicaid could offer and still help them remain in age in place as opposed to having to move to a facility. And so, that's an alternative, and Medicaid waivers really partner hand in hand together. This one is on emergency medical services for aliens, or the MSUP program, and it's really a limited time service that's available for emergency services. So folks that don't have a qualified non-citizen status, which is one of the typical requirements for a Medicaid program, they could apply for the MSUP program if they have an emergency need or medical service that's needed, and they meet all the other eligibility requirements, then the non-qualified citizen status could be waived under those certain circumstances. And again, it only covers treatment for emergency medical conditions as defined under that program. Some other Medicaid programs, and this is not an exhaustive list, but shows a lot of them. There's, again, the Medicaid Children, there's CHIP, 599 CHIP, which is coverage for the unborn, which is technically in Nebraska separate from Medicaid. That's the only bit where it's a little bit separate, but still covers the same services and all that kind of thing. Hospital presumptive eligibility, coverage for the aged, blind, and disabled. Folks can be dually eligible, like we talked about earlier. There could be medical need, or cases where they have really high recurring medical expenses, and so they're spending a portion of their income on those recurring medical expenses to such a degree that it drops their income below a federal poverty level to qualify for a program. Those are programs that are available for folks. Transitional Medicaid for folks transitioning and maybe they got a new job that their income's higher than it was, and they're transitioning away from Medicaid. Spousal impoverishment, former foster care. So there's all kinds of programs, and many of them target different maybe life circumstances or different circumstances for the individual. Medicaid for incarcerated individuals. This has been really a point of interest, I know, both federally and at the state. And there's a lot of work that's been done. DHHS has been working really closely with facilities all around the state and really working to. So typically, when someone becomes incarcerated, if they were Medicaid eligible, they would just be suspended while they're incarcerated. They could qualify for services if they have like an emergency hospital, stay that they need to have, and they're out of the facility to go to the hospital. They could qualify or be reopened if they already were eligible. But there's also a lot of efforts that are undergoing now to partner with the facilities. So before folks get out, to determine would you be Medicaid eligible, help them, get set up and determine what that looks like as they're transitioning out of the facility, It really just helps kind of them understand if they are Medicaid eligible and starts that process early as opposed to them getting out and then having to navigate all of that all at once. So Medicaid services in Nebraska, certain services are required to be covered under federal law and others are optional for states. And we talked about that, some of the things that Nebraska covers above and beyond, like those over-the-counter and dental and vision. So services in Nebraska include but aren't limited to physician services, hospital services, ambulance, dental, like we said, prescription drugs, all kinds of things. It's a really pretty comprehensive package. And Medicaid services have to be equally applicable. You know, the quality has to be the same and the benefit has to be the same, regardless of where somebody lives. So, you know, folks can't receive less services just because, say, they live in western Nebraska. They have to be the same throughout the state. And how are Medicaid services delivered? I referenced this earlier, but there's what's called the managed care program in Nebraska. That's called Heritage Health. And that really was where Nebraska Medicaid partners with these managed care programs or managed care organizations, MCOs is what they're often referred to as. And so we partner with them and they then administer a lot of the day-to-day, a lot of the administrative stuff. They really oversee all the service delivery. They work with providers. Providers will bill them. They'll do the reimbursement. They'll work with beneficiaries also to help oversee their case. There's a lot of supports that they'll offer to beneficiaries, kind of above and beyond what Medicaid would do. And so that's really that managed care. If you hear that managed care program, Heritage Health, that's where Nebraska Medicaid is partnering with these organizations to administer Medicaid, essentially. The three companies in Nebraska are United Healthcare Community Plan, Molina Healthcare, and Nebraska Total Care. And in Nebraska, it's set up so that as folks enroll, it kind of just goes one, it divides it up evenly. So there's not competition. The MCOs in Nebraska are really collaborative, and it's a really good setup. They work really together to make sure the benefits are working for folks, and it's not a competitive scene, which is really good. So they also offer some care and case management, like I was referring to, and that just helps support folks with their wellness goals, addressing quality of life things, addressing some of those social determinants of health. Enrollment is voluntary in that care and case management. It can be ended at any time. And especially for the long-term care space, they can offer a lot of those services and supports, or helping folks navigate what options are available, helping them with transportation, those kinds of things. And they can also help with community resources, finding housing assistance, childcare, so kind of some of those other things beyond just medical care. The MCOs do a lot in that regard as well. So with that, that's the end of the presentation, and thank you all again so much for having me. And I see the laptop hand up.
Yes, we have one email question that's come in from Lori Thomas, and this says, when it comes to determining what the Medicaid managed care companies pay for, does DHHS determine what managed care companies can or cannot pay for, or do the managed care companies determine what they cover?
That's a good question, the answer of which is multifaceted, but essentially Nebraska Medicaid, then we have contracts with the MCOs, and the MCOs have to cover the MCOs have to cover the Medicaid services that are covered in that state plan with CMS. So they can't say, oh, we don't want to cover physician visits, because that is covered under Medicaid. So they have to cover those services that are outlined by Medicaid. That's in the contract. With each of the MCOs, there is some leeway in terms of utilization management or different things that the MCOs might administer differently. Again, some of those things that go above and beyond might look different for each of the plans, but they do also generally have to follow Medicaid, all of Medicaid regulations. They're bound to that. All of the federal and state requirements that would apply, they're bound to that. So I guess the answer, again, it's kind of complex, is yes and no. There are things that they have to cover. They have to cover all the basics of Medicaid, but then there is some leeway outlined in their contracts above and beyond that. So, yeah, any other questions? Awesome. Well, thank you all again so much for having me. It's been a pleasure.